This is week 2 of Hispanic Heritage Month. Our music today is going to be presented by David Rogers.
Thank you, President Rick, fellow Rotarians. In honor of today's presentation for Hispanic Heritage Month, our music is a danza by the famous Cuban composer Ernesto Lecuona. The title translates to Finally I Saw You. This is arranged by another famous Cuban-born musician, Paquito de Rivera, who is playing clarinet here, and he is joined by yet another Cuban-born musician, bass clarinetist Diana Alvarez.
As you can tell by the beat of the music, we have a little Cuban theme for today. And if David Rogers would let me share just a little story, I got an email from him. He said, well, here's what I got, but I looked at so many videos of Cuban music, but then there were so many dancers and that came out of the woodwork dancing to this music. So this is a toe-tapping beat, and thank you for finding it and presenting it. And our invocation, if you would please stand.
So today I'm going to read another excerpt from Maria Shriver's book. I've been thinking, reflections, prayers, and meditations for a meaningful life. This one's called The Power of Empathy. Empathy is a feeling. It's different from sympathy, different from tolerance, even compassion. Empathy is the ability to share someone else's feelings, the ability to understand another person's experiences. In short, the ability to walk in someone else's shoes. That can be hard. I believe that the vast majority of people are good and want to live in a more caring and compassionate world. The path to that world starts with empathy. And because we're more diverse than ever, more globally connected than ever, empathy is needed more than ever. But I know there are many who believe that vision is out of reach. They tell me the rampant us versus them mentality, the demonization of people who aren't the same as us, all that will continue to take precedence over any feeling of fellowship we might have with each other. I strongly disagree. I believe that creating a more caring, compassionate, and peaceful world would begin with understanding the experiences of the other, with appreciating all of our differences and accepting that people don't have to be, look, live exactly like we do in order to be worthy. I've discovered that when someone has had empathy for me and my own experiences, it softens me and encourages me to give that same gift to another. who may be similarly encouraged, and on and on and on. So today, think about the time that you have felt someone's empathy for you, and know that that gift resides within you to give to someone else. So would you pray with me? Please give us the gift of empathy, of understanding another person's life experiences. Help us to listen to those experiences without judgment. Soften our hearts so that we may feel the heart of another. Amen.
Thank you, Leanne Antonio, for a very, I think, important message today. I think we never run out of enough empathy, so thank you. I'd like to welcome our guests today, and if you are a guest, would you mind standing so we can acknowledge your presence here today? It looks like we have, all right. And thank you for coming. All right. Got a couple more things, Greg. I'm going to take a few minutes to talk about Paul Harris Fellowships. When a Rotarian contributes $1,000 to the Rotary Foundation, a Paul Harris Fellowship award is earned. So where does that money go? It goes to the Rotary Foundation. How do they use it? It transforms charitable contributions into programs that fight polio and build peace, into humanitarian projects that change lives, and into scholarships and vocational training. The funds are also used for local projects that Rotary members feel passionate about. As a global organization that operates in nearly every country, Rotary takes stewardship of its funds seriously, and Rotary received a 4-star rating from Charity Navigator for 14 consecutive years. I'd like to invite Wayne Nelson to the podium, and as he's approaching, I'd just like to say that Wayne was an active Rotarian, downtown Yakima Rotarian, from the years 2006 to 2018. His classification was residential real estate. My classification is real estate agency. We work in the same industry. We're competitors. But Wayne is a classy competitor. His prior vocation was a high school Spanish teacher and history teacher in the Yakima School District, and I believe, if I have the number right, 32 years? 32 years. Maybe some of your kids had him for Spanish or history. Wayne is invited here today to receive a Paul Harris Fellowship Award, which, because of possible oversight and COVID, was not presented while he was an active member. So I'd like to apologize for that. But it makes it, I think, even more important that it be presented today. Our motto is service above self, and I think Wayne has demonstrated that in his occupation, in his life, in his time with the club, and I'm he will continue that as he goes forward. So before I present this, I'd just like to read what is on the certificate. Wayne Nelson is hereby named a Paul Harris Fellow, in appreciation of tangible and significant assistance given for the furtherance of better understanding and friendly relations among peoples of the world. Wayne Nelson, thank you very much for your contribution and your contribution to our city and in the past, our club, and I know you'll contribute going forward. Congratulations.
They say I have 30 seconds, and those of you who knew me well know that would be difficult, but I'll stick to it. When I first got into Rotary and heard about the Paul Harris Fellowship, I was just immediately drawn, and Leanne's words about empathy, I think the Paul Harris Fellowship is all about spreading that kind of empathy in the world, and I thank you so much.
Let's see, is Andy here? Ah, there you are. I'm going to let Craig introduce our new member, and then I'll ask you to come up and make your announcement.
Well, President Rick, members and guests, it's my great pleasure to introduce Jolene Sita to the finest Rotary Club in America. It's been a while since you've heard that, hasn't it? Anyway, like many of you, Jolene was born at a very young age, and she spent her childhood on the Kitsap Peninsula and then finished high school in the Methil Valley. She is a proud Wildcat alum, having received her undergraduate and master's degrees in science and organizational development from Central Washington University. I came to know Jolene in 2001 when she started working for the Yakima Valley Farmworkers Clinic in their HR department. In 2006, she was recruited by what most of us referred to as the May Clinic, which is the Medical Associates of Yakima as our HR director. And then in 2015, Jolene became the vice president at Virginia Mason Memorial's HR department. Jolene is presently the CEO of Triumph Treatment Center. She's on the board of United Way. She was formerly the board secretary for the Dispute Resolution Center for Kittitas and Yakima counties. Jolene is the past president of the Washington State Healthcare HR Association. So Jolene, when she's not working, is everything about sports. She skis, she water skis, she camps, she fishes. So please join me in welcoming Jolene.
Jolene, this is how you get a standing ovation, so enjoy it. Whoops. We have some things for you. First of all, your red badge, which you will have an opportunity to convert to a blue badge after going through our rigorous Rotary education process. Not really. Rotary roster with contact information about all our members, a plaque to put on a wall, your office, home, wherever, and then always the Rotary, coveted Rotary license plate holder.
All right.
Display it proudly.
Thank you.
Welcome, Jolene. All right, okay. Andy's going to come up and talk about, oh, excuse me. Just a second. All these directions here. Oh, this is very important. Inside this envelope are, I can't even count how many tickets are in here, but normally at this time of year, we have been at the Central Washington State Fair. Many years ago, we took, at that time, called crippled children, handicapped children to the fair, Hoover School students, and that went away, and we went and had a program there, and we visit the fair. But this year, we decided to do it a little differently. We're not going there, but we are sending a lot of people there, a lot of kids and families who are part of Triumph Treatment Center's clientele. So that's what Rotary is doing for the fair this year. Thank you. All right. Andy, I'll let you make your announcement.
Thank you, President Alderson. Good afternoon, fellow Rotarians. Thank you for a moment of your time. I know we're all very busy and have lots going on, but as I shared last week, actually, as President Alderson shared last week, we have a Rotary-sponsored day at the Yakima Fair this year, and it's on Saturday. On your tables, there's a bright green piece of paper We're still looking for a few volunteers, and we're reaching out to all of our Rotarians in all 3 clubs across across Yakima. So on that list, there's also some items that shows you all activities that you can participate in, and we really only need 2 hours of time. With that 2 hours of time comes entry into the fair, and then of course you can go and enjoy the fair if you'd like after that. So we're hoping to get a few more Rotarians. The shifts are listed on the green sheet of paper. They're just 2 hours apiece, and that's this Saturday. It's the Rotary sponsor day, and it's specific to the STEM building. So it's just Pioneer Hall, and we'll be in there with all of the STEM activities that you see listed. So I'm hoping some of you will join us and be able to give us a couple of hours of your time on this coming Saturday, the 24th. So thank you very much. Thank you very much for the time. Turn it back over to you.
All right, next up, have a very important project that we are involved in as a club. And David McKinney and Pete Bansmer and Charlie Eglin are going to come up and convince us to all get involved in it. There's a way to get involved for everyone. Here you go, guys.
All right, Rick, thank you very much. Thanks, Pete, for being here. Thanks, Charlie. I'm going to introduce these guys, which probably don't have any introduction necessary, but Operation Harvest, Saturday, October 8th. That's not the only day we need help. We need lots of help leading up to that. And the biggest thing we need help for at the moment is to distribute the bags. We've figured out that getting the bags onto the porches is the single most important part of this entire project. But we've also got some other ways for you to do that. You can sign up by scanning the QR code on your table here and sign up electronically, or you can use the pen on your paper that's on the table there and sign up manually and make Lorna or Carolyn enter it into you for you electronically. But I'll let Charlie go ahead and say what he's got to say about putting it on the porch with your neighbors.
All right, thank you. One thing that I started doing many years ago and keeps expanding, and I love doing it, my neighbors hate it, but I send them a letter. And on here, I ask them to make sure they put their food out by 9 a.m. on Saturday, October 8th. But if they don't want to put food out, they can also write us a check. So I give them the address, and we now have a new QR code. They can just, for those that are more technological advanced than I am, you take your camera, you do that, you enter your credit card, and you can make a donation to the Rotary Operation Harvest. But I also send out, and I don't need to tell you how many I send out because I'm embarrassed about that, but I send out a self-addressed stamped return envelope. So when they open this up in the mail, all they have to do is write a check, put it in there, and stick it in the mailbox. That's it. And it has worked wonders over the years. So I encourage you to send out 3 or 4 to your neighbors, or 13 or 14. Whatever you can do, it works really well. Thank you.
Kate, I'm here to share some stories because I work at the Yakima Rotary Food Bank. Every Wednesday and Friday, once we sort the food, we have the food that we give away inside, then we have the market, which is marginal food, and then we have the farmer come and pick up a pickup load of food that you'd throw in the garbage. The farmer who comes today, what they'll do is they take that pickup load of pig food, they go down to the river because the couple that drives that truck lived on the river for 5 years. They allow their friends on the river to pick through the pig food before they take it to feed to the pigs. So if you're concerned this food does not go out to very, very needy people, it does. One other quick story, about 4 weeks ago, not everybody knows that there's an ample amount of food at the food banks. We had 2 elderly ladies, probably younger than me, but when they realized that there was a food bank every Friday at the Yakima Rotary Food Bank where they can come and get a 30, 50-pound box of quality food, they were crying, both of them crying. There is that need in this community, so please help us collect as much food as we can. It doesn't go as far as you think it does, even though it's pretty impressive when we see that. So thanks for your support.
Thanks, Pete. Thanks, Charlie. Again, we're looking for about 35 people to sign up to deliver bags to the porches, and so a few more people to sign up for the collection site, and a few more people to drive the routes to collect those bags. So thanks for signing up.
I want to say thank you to those who are leading this charge. Dave and Sherry. Sherry Bissell is here, I think, somewhere. What a huge job. But it can be an easy job if everybody participates. And there are many ways to participate. I think there were 7 ways. You can write a check, or you can be actively involved in stapling parties. I think are we having a stapling party after Rotary? Oh, it's tonight. That's the Rotary Education, yeah. So Jolene, we won't be doing this probably when you go through the Rotary Education, but we have this captive group, and we're going to have a stapling party, stapling the information on the bags that go out to the porches prior to the pickup date. So, work the collection sites, look and see what is available, and sign up. There's a way that you can participate, because the end of the effort is so positive on our community, and that's what we're here for. That's what we do. We're a service club. All right. Felix Riffa. There he is. Felix is going to give us a little bit of, a little story. And looking forward to it. Thanks, Felix.
Hi, folks. President Rick, fellow Rotarians, and by the way, I brought a timer because I was told that I will get the hook from Fairbrook if I exceeded my time. So, I was born in Cuba, in a town called Camagüey, many moons ago. I was raised in another town called Santa Clara. My grandfather at that time had 4 coffee shops, and my dad had owned one of them, a 5th one, and he managed them all. He was managing those till about 1966, from the 50s to that. Somewhere at that time, probably in the 63, there was a time of collaboration between the U.S. and Canada, and Cuba, I'm sorry. They had established what was called the Freedom Flights. Those flying from a town called Varadero, which is a very beautiful beach in Cuba, northern part of Cuba, to Miami. And you had to be a sponsor by a close relative that was a U.S. citizen. In this case, it was my dad's brother, Uncle Jaime, as I was referred to him. Now, here's an interesting story about my uncle. So my uncle was a very feisty guy, 5'6", short, skinny, always got into a little trouble. My mom used to say that she hated him at the beginning of when she was dating my dad, because my dad always had to leave the date to save my uncle out of a fight. And he didn't pick on one guy. He picked in several women, and they're always bigger than my uncle. My dad was a big guy. He was 5'9", black belt in judo, and a weightlifter. So we always had to get him out of trouble. So my uncle is going decides to go to college in the early 40s, or 44, he's still going to school, and he calls my grandparents. Hey, I want to enlist myself and go fight World War II for the U.S. Army. So my parents, my grandparents, just, no, can't do that. No. They all told negative, but as my uncle did many times, he didn't say nothing, and he enlisted himself. He was in 44. He was in the Army, one of the guys that landed in Okinawa, fought there. The war ended. He made it through. He didn't say nothing else till later on in his life, and when he went back to Cuba. So this is now fast forward to 1956 to 59, somewhere in there. Batista is the regime, the ruler, the president of the Cuba. He was crook, and he was a lot of people that were having, a lot of problems. It was better than nowadays, but at that time, Fidel was coming into power. So my uncle and some friends was going around listing himself or doing things to overthrow Batista too. So was favoring Fidel. Now, this is now 59, and my uncle, one of the things he did, he took care of a ranch that my grandmother owned, and he would travel between the city of Camagüey, where I was born at, and this ranch, probably an hour away. And he's coming back from one of his trips, and he gets stopped by a military checkpoint. And kind of rare, because he wasn't there in the way there. But he noticed that the military was having some guns, and it didn't look familiar to him. But he recognized, he got a little closer and recognized it was Soviet-made. At that moment, he knew that Fidel was going to turn communist to follow the Soviets at that time. So then he does, with some of his friends, same friends that were going up in Batista, he starts doing things against Fidel. And the Fidel clan was looking for him also. So they even tried to arrest him, but he hid. So he jumps Guantanamo Bay fence and hides for their couple of months of hiding. They were coming out because they were not sending you back, but he then can't get to the United States yet. So he's stowaway on a ship that comes to the United States. And he comes out, it's Thursday, they feed him, but he gets thrown to the brigs, and then they interview him, and they're gonna send him back. At that time, if you were sent back, you were stood in front of a wall, they call it paredón, and it was basically they just shoot you. There was no judging, no trial, no nothing, just you were bad. And in the interview that they're doing to him, his military service comes to light. And I said, oh, well, let's check. So they went and checked, and they brought papers back to ease his pain or ease the way to becoming a citizen. So he was able to stay. Now, because he did a mistake, so this is how life is. He did something against his parents, but he became a U.S. citizen, which was able to then sponsor us to come to the United States. So my dad, my mom, and my sister and I were able to come because of him. I still got time. My family said, my parents and my sister and I settled in a little town in Florida called Clewiston. Clewiston is an agricultural town, pretty much like Yakima, except that it's flat, very flat. But the sugar cane, a lot of small vegetables and stuff growing. Anyway, my dad's first job was, after he went around Florida looking for different relatives that we had, but his job was driving a tractor and basically running through the fields, just clearing the fields. The South Florida, if you're familiar with it, there's a dirt that is black, it's called muck, and it's very light, and it just, when you go through with the tractor, it flies everywhere. My dad used to come home black, and he would have goggles to put on and a little ear plug, and it still was all black everywhere. For a long time, my mom, we used to stand, there's the shower. That's why he was going for the shower right away. He then became a milkman. Some of you folks remember when you had a milkman coming to your doors in the early mornings. He was able to buy the route that eventually, his route, and then eventually another 4 routes that other people joined. So he became self-employed. That's kind of why I became self-employed. He worked early, 3 a.m. to noontime. Paperwork, he took a nap and then he did paperwork after that. He did this for over 10 years. I never saw him 6 days a week. Never saw him take a vacation till that or retirement came along. He was, my mom and dad were very thrifty, very hardworking. My mom was a housewife, and she always had money, but she never let my dad know, because she will get some money a month, or a week, depending, and she was always made it just enlarged. And I never, in my house, there's never leftovers. What do you mean? What I mean by that? She made it into something else. So if it was a piece of a chicken, she just made it with rice or something else, that it became a different dish for the following day. But so we used up everything. She's extremely thrifty. She let me have a lot. I got it when I went to college. I have a little money from that. I myself went to college, didn't finish, but I got 3 years out of my way. Went to Tampa, stayed in Florida for probably 17 years. Then I was working with a company called Alamo Rent-A-Car. They moved me to Texas, where I met my lovely wife, Rosie, and we got married. And then the company said, hey, would you like to go to Hawaii? I go, hey, who would not like to go to Hawaii? It's a little nice job. So I asked my wife, would you, well, she wasn't my wife then. I asked her, would you like to move it with me to Hawaii? She goes, of course I would, but not if I don't have a, oops. So I guess I planned a wedding in 2 weeks, got married, and from there went to Seattle. Actually, I took her on a honeymoon. Every time she says something about her, the reminder that I had a honeymoon, almost 3 years honeymoon in Hawaii. Who gets to have that, huh? But anyway, from there I went to Seattle, worked with different companies, and then I ended up back in moving over here from Bridgestone Firestone worked for them for many years until I decided to go on my own, and here I am, folks. Thank you very much.
Hey, thank you, Felix. That was kind of like a classification talk with family history. So, well done. Mike Johnson. Is there Mike Johnson in the room? Do I have the we do not have a Sergeant of Arms today. Who would like to be the Sergeant of Arms today? Anybody who hasn't been to Cuba, you can pay $1. All right, we dispensed with that pretty quickly, which means we have more time for our program and our speaker, which worked out pretty well. So, all right, Bruce Bacon, while they're collecting the dollars, of which there are many, introduce our speaker today. Thanks, Bruce.
Thank you, President Rick. It's my pleasure to introduce Dr. Neil L. Barg. Neil officially began his role as a health officer for Yakima Health District in August 1st of 2021. His role as a health officer is to provide subject matter expertise, help craft policy and health orders, and guide the Board of Health on its health strategies and concerns. Dr. Barg is an infectious disease specialist in Yakima and is affiliated with the Yakima Valley Memorial Hospital, Pacific Northwest University, and the University of Washington. He received his medical degree from Temple University School of Medicine, and he's been practicing as an infectious disease doctor and consultant for the last 22 years in Yakima. He currently serves as the Director of Hospital Epidemiology and the Director of Antibiotic Stewardship Program for Yakima Valley Memorial, and is the Medical Director for New Hope Clinic at the Yakima Valley Farm Workers. Dr. Barg is also a clinical professor of medicine for the Division of Infectious Diseases at the University of Washington. His previous positions include Associate Professor of Medicine at University of Michigan Medical School and Associate Professor of Medina Vanderbilt University School of Medicine. In addition to being one of the smartest people I know, he is also a great neighbor and a friend to me and my family. Please welcome Dr. Neil Barg.
Okay, I'm going to stand down here because I have to be able to read the screen, or this one here. So, so we went viral. It's been a little bit of a rough ride, especially if you're the health officer. And I'm going to review a few subjects here today. I'm going to talk about the status of COVID, and then about monkeypox, and then the return of polio, which is perhaps the scariest thing of all. So the COVID update. We still have cases, but they're decreasing. We still have deaths, but they're decreasing. And we have fewer people with severe disease. All these are excellent outcomes from a very large group of people that have worked very hard to change behaviors, enforce mask mandates, get vaccinated, and generally reduce the exposure to the virus. And the result is what you see up here. On September 7th, 2022, just a few weeks ago, there was 144,151 cases in the United States. That is triple the amount of influenza that we usually see. And the 7-day average was 71,255. So we've got plenty of COVID around, and despite what the president says, the pandemic is not over. We have to still be diligent. There's some alcohol and masks there if anybody wants any. So the majority of the deaths occur in the unvaccinated. I have a graph that will show you that. And now between people having had COVID and getting vaccinated, most of the deaths are in the elderly, greater than 75 years old. There's a few people out there I know that fit that category. I'm getting close myself. Sorry. If we look at the kind of diseases that are going on in the country, only diabetes, heart disease, cancer, and stroke kill more people than COVID do right now. That might sound bad, but actually, a year ago, COVID was way further up on that list. In the last 2 years, a new strain has emerged every 3 months, and those strains are usually different, and if you've had COVID before, you've been vaccinated, the protection isn't quite as good, but it's still better than nothing. So far, there hasn't been a new strain for 4 months, so the pattern may be changing. And the more time there is between strains, the less problems there'll be with disease. The current status, there's 2 strains going around, B4 and B5, and the old vaccine does not cover that as well as it did the original strain, but again, still better than nothing. Most people have a pretty good chance of having some resistance to severe disease with the old vaccine, so it's not by any means unhelpful. There's less protection against the new strains, and there's hope. The new bivalent vaccine has the ability to raise antibodies to both B4 and B5, and the other half of that is for the old strains. So it should be very helpful as soon as it becomes available, probably in October. You can all run down to Walgreens and get it. I'm going backwards, I think. Sorry, I'm not used to this. Okay. Right now, in contrast to a year ago and 2 years ago, there are no patients on ventilators at Memorial Hospital. There was a time where all 12 ICU beds had COVID patients in them, and half at 2 Northwest, which Dick and Jim will remember, had ventilators. And we had to borrow ventilators. They had so many patients that needed them. Having 0 right now is a huge improvement. All right. I think I got the right button now. No. Sorry. Okay, there we go. All right. So we do have some options when we have patients with COVID. There's post-exposure treatment. So if you went home and found out that your kid came back from a trip to New York City and tested positive for COVID, and you're elderly, over age 60, you have options. You could get a monoclonal antibody, which would occupy the virus and decrease the number of circulating virus, and you wouldn't get as sick. You could get a drug called remdesivir, and you'd get 3 days of that in a row, and that does a very good job at reducing the chance of severe illness as well. Or you can get a medication called Paxlovid, which was introduced earlier this year, and does the same thing. It reduces the chance of having severe disease. For some people, pre-exposure prophylaxis is necessary. So you're at higher risk for getting the disease, but you don't have it yet. And there's another monoclonal antibody called Evishield, and we've been giving that with people that have transplants or severe underlying diseases like dialysis. People with COPD, all of them can benefit from getting this drug. So that's another option we have. We also have vaccines. In multiple studies, the vaccine has been the most effective means of preventing severe illness. And that's true even now with the new strains out, as evidenced by the fact nobody's on a ventilator at Memorial Hospital. The death rate among unvaccinated people is 10 times the death rate of vaccinated people. So I take my chances with the vaccine any day. Here's a graph where you can see the death rate by vaccination status. Fully vaccinated is way on the bottom of the slide, and the big curve in the middle is the patients who die from not being vaccinated, or the non-vaccinated deaths. Big difference. So we're going to switch now from COVID to a new infection in the United States, but not a new infection in the world, and it's called monkeypox. So you see these lesions that are typical for monkeypox. They're small vesicles that are filled with fluid initially and then filled with purulent or pus with a red base around it. And they'll break open and drain, and then a scab will form. And after about 2 weeks, the scab will fall off. And if that sounds familiar, it's similar to chickenpox and smallpox. So when the scab falls off, persons are not infectious any longer. So it's an old virus that used to be confined to certain areas in the world where it was endemic and probably came from animals. So the reservoir was in animals, it went to people, and there have been outbreaks, but they've been in sub-Saharan Africa, so we don't hear about them. It occurs primarily in those people who, here in the United States, who have had close and prolonged contact. So if you were hugging somebody for a long time at a party and they had monkeypox, you could pick it up from them. But just casually walking by or shaking someone's hand, you're not going to get monkeypox. In the United States now, it's much more common in urban areas than it is in rural areas. For instance, Seattle's had close to 1,000 cases. We've had 5. So pays to be in the country these days, huh? The vaccine is available, and it's in limited supply right now, but we are giving it in town to people who are at high risk of acquiring disease or for people that we know have been in contact with somebody with proven monkeypox. It is very effective at preventing the acquisition of the infection as well as preventing it from progressing to a severe infection. Deaths are uncommon due to this virus, but they do occur. The state of New York has declared it a public health emergency, but it's not a pandemic. What that declaration says, it doesn't mean it's an emergency, but allows them to shift funding into fighting the disease. So it's not necessarily a horrible thing to be put in the middle of this emergency declaration. It's more of a government function than actual assessment of the risk. Few people are hospitalized for this, and it's usually for severe pain. The lesions hurt, and if they're around the mouth or around the genital area, they can be extremely painful. For instance, if it's around the mouth or in the mouth, you can't eat or drink. So they come in the hospital, get an IV, and other pain medications to stabilize things. The risk of infection with monkeypox is similar to the risk of infection with sexually transmitted infections like gonorrhea and syphilis, and also HIV. Again, the reason is because it's proximity. The sexually transmitted infections and HIV, it's close proximity, as it is with monkeypox. You can also pick it up from contaminated linens or towels that have the contents of the pustules on the towel. Now, simple washing of those is enough to get that all off of there and not be risky anymore. But for instance, in places where there's quick turnover of people and the beds may not have the time to get clean, we've thought that there might be outbreaks in certain places, some of the respite places, but it hasn't happened. Obviously, people are taking enough care to make sure that's clean in those areas. Some people have a minimally symptomatic disease, but they can still spread it. So it's possible that you see somebody who's not sick at all, and they may have monkeypox. So there's not a 100% way of preventing it from spreading until the vaccine becomes widely available. Once it becomes widely available, then we should really be able to knock it out completely. Here's the good news for us old guys. If you got smallpox vaccine, you're protected against monkeypox. And if you were a person that was a candidate for it, you'd actually get the smallpox vaccine. That's how good it works. The vaccine's in limited supply because we haven't had a case of smallpox for a long time, so we no longer vaccinate anybody for smallpox since 1979. So it pays to be old in this case. We are administering it to high-risk people, like I said earlier, and it's administered to people with known exposure to a case. There's also a drug, which the name of which is way too far to pronounce in a non-medical community setting like this, and it's an antiviral. It was originally developed for smallpox, and we have not needed to give it to anybody in Yakima. and it has to go through me for anybody to get it. So if I'm telling you nobody really has got it. All right. We don't really know, though, if it's helpful against monkeypox. They have given more of this in urban areas. Seattle's had a couple administrations, but the number of people that have got it is too small to really know if it makes a difference. However, it's there. Already, the incidence of monkeypox is decreasing because the news has gotten out about what allows it to transfer, and people are changing their behavior. Plus, people who are at risk and people who are exposed have the vaccine and they don't get monkeypox, so they can't spread monkeypox. So this might be turning down already, which we all hope. All right, who remembers what this is? Yeah. So when I was a resident at University of Michigan, the 11th floor of the hospital was the respiratory floor. So people with COPD and asthma that needed hospitalization would go up there. And there was a closet at the end of the hallway that contained 25 iron lungs. And you couldn't get in, it was locked. There was no need for them. Why was there no need for them? Let's talk about that. So this was quiet. Nobody worried about polio for a long time. But there was new cases in New York City a couple months ago. Those are the first cases reported since 1979. Polio virus is now circulating in the US because of wastewater surveillance. They can detect it. So with special molecular methods, you can get wastewater samples from any town and test it for the presence of polio virus. And in New York City, that's exactly what they found. We don't test here yet, and I've asked that we figure out if we can, because it's a good surveillance method. We are testing for COVID virus in the wastewater, as they are in many places. So because of that, we know it's circulating. We just don't know how many places it is circulating. So there's 3 strains of poliovirus, and they're type just 1, 2, and 3. And in the old vaccine, all 3 components were contained. And as they looked at what kind of virus people were getting infected with back in the 80s, they saw that nobody's getting infections with type 2. So they removed it from the vaccine, and a lot of people were only vaccinated for 1 and 3. Many cases of polio are asymptomatic. So vaccinated people don't get it, but unvaccinated people can get polio, but not know it, and they can spread it to other people. The strains that are used in the vaccine to prevent spread are used, they're attenuated, which means they're not really efficient at causing infection. And that's in the oral one. In the one that you get intramuscularly, it's essentially a replication deficient virus, so it can't do anything to hurt you, but the oral one can sometimes cause infection. Why does that happen? So here's what happened over the course of vaccination programs all over the world. The red indicates where there are active polio transmission in 1988, and with an extensive worldwide effort at vaccinating people, you had in 2017, you only had Pakistan and Afghanistan and one of the countries in Africa that had active polio. So things were looking good. This map shows where new cases have been reported, at least in Europe and Africa. So, 2017, none of these areas were reporting it except Afghanistan and Pakistan. So let's talk a little bit more about polio in wastewater samples. These are viruses that are in people, and they excrete it in the stool, and that goes into the wastewater treatment. So how does polio exactly get in? So it's spread by fecal oral, so oral contamination from people not washing their hands, for instance. So if somebody's in a cruise ship and they're not paying attention and there's a polio case on there, it could be spread. That hasn't happened yet, but it's possible. Once it's shed into the stool, it gets into the wastewater, like I said, and there's techniques that can determine not only that there's polio there, but what strain is there. Is it strain 1 or strain 2 or strain 3? Now, if you have a population living in a specific area that's under-immunized, and there are places in the US where only 30% of the population in that area are immunized, that creates a problem. So there's enough people that aren't immunized, particularly kids, where the virus can be replicating. And what happens if the virus replicates in many people over many months? There's time for the virus to mutate. So the viral strains, of course, that are used in the vaccine are not neuropathic, meaning you won't get paralytic polio. The people who don't get paralytic polio can still have asymptomatic shedding, and eventually somebody's going to get it in their system and they'll get paralytic polio. If the vaccine virus circulates among people from time to time, person to person, the mutations can turn the virus back into a neurotropic virus, which means you'll get paralytic polio. So at the current time, the vaccine that's circulating, that started in Africa, or not the vaccine, but the strain that's circulating, that started in Africa, and it is in New York City, is the type 2. And they've looked at all the people that have gotten it, and they all have type 2. So this is a single strain outbreak. Most communities don't have wastewater sampling like our community, so we really don't have an idea how widespread this problem is. The big problem is polio circulating in an area, and more our communities, then there'll be more chance for mutation and more chance for people to get paralytic polio. Since vaccination rates have been dropping across the country, and part of that is the effect of COVID, so it's affecting the administration of many other vaccines because of vaccine hesitancy, we're at a particularly vulnerable time in the history of vaccination of polio. So the next time you decline a vaccine, think of this picture, the little kid standing there in braces and crutches, and all his friends are playing football. Why? Because he didn't get vaccinated. So how do you stay healthy in this era where we have viruses circulating? Get vaccinated. And that's what I got. Any questions?
You have a lot of time for questions, and hopefully there are many.
Yes.
Neil, I went to Walgreens yesterday, and that what they said was the newest shot, but it's not bivalent.
Some places have it and some places don't. You just ask them if it is. So, yeah, no, I mean, they're not going to lie to you. I mean, it is Walgreens, right? Yeah. Yeah, so the bivalent is currently the newest, and that'll give you a bump in the antibodies to the old strains as well as the new strains. So that's the best thing you can do. You don't have to run out and get it today. Anytime in October will be fine because we don't have any newer strains coming out, so I expect this one will be an excellent booster and reduce even further the risks. All right. Question in the back there also? I'll tell them. Yeah. Yeah, it just wasn't necessary. I mean, the first recurrent case we had was just a couple months ago in New York City. So getting ramped up to do it in wider space or wider areas just hasn't occurred yet.
Would it be wise for us to do that?
You know, I think doing things preemptively is always better than doing things reactively. So I'll talk to the health district and see what it will take. We don't have the resources to test here. We'd have to find somewhere where we can send the samples and get tested. But that's being done with COVID already. So part of the infrastructure is there. There's a question over here. But not John's. If you can determine that, it probably wouldn't be a bad idea, but right now, it's back to 1, 2, 3. So current vaccines will protect you. John had a question first.
Those of us that are elderly and had our vaccines.
Are you including yourself in that? Oh, okay.
God, yes. Had our vaccinations for polio in the 50s. They had all 3 types, and should we, is there a booster, or should there be a booster, or are we at the present time
Yeah.
Safe for what's going on?
Yeah, so did everybody hear the question? So John asked if the vaccine that was given in the 50s had all three in them, and they did. And people who got the oral, some of them have already gotten the injection, and then more recently, people that have gotten the oral getting injected again. So if you go to a country that has endemic polio, the recommendation from travel medicine people is to get an injectable form. And since the virus is not alive, there's no chance of getting polio from the injection. However, the oral is attenuated, and there's about 1 in a million cases of polio from that vaccine. So it's quite rare. Yeah.
My observation is during COVID and so many people wearing masks is not very many people got the flu, or seemingly fewer people got the flu. So should we expect those flu numbers to rise this coming year?
Absolutely. So the question was, with mask wearing for COVID, there wasn't a lot of influenza. With no masking now, essentially, are we going to see an increase in influenza? Absolutely. We sure will. I mean, we're already having cases, but it's not that fast yet. But don't hold your breath. Let's see. Question?
Are there any hazards in having the flu vaccine at the same time as the booster becomes available? Any hazards of having
Right.
those together, or
So,
any hope for anyone to take care of the flu?
so I'll answer the last one first, and they're probably going to have a combo vaccine available, like there is for hepatitis A and B. They have them both together in one shot. Then the first question is there any risk in getting the flu vaccine the same day you get the COVID vaccine? And the idea would be get one in one arm and one in the other arm. I got my flu vaccine here, my arm's paralyzed, so, you know, just kidding. But somebody said that's why God gave us two arms. Question there?
So any concern about somebody who's had a recent exposure to COVID, like currently go to get a vaccine, any complications from that?
So are you asking if, like, say you had Omicron over the summer, is there any problem with getting a vaccine now?
Or that I'm currently, like maybe yesterday I got exposed to somebody and I potentially, my immune system's dealing with that.
Well, there's no danger to you, but the COVID may not work as well because the antibodies that are generated by the vaccine may be used up by the active infection. So the way to get the antibody titers to the highest if you've had COVID is to wait at least 2 weeks before you get vaccinated, and then you get the maximum effect. Now, people who both had COVID and are vaccinated are the safest of all because you have a double incentive, you know, or effect. All right, there was Roseanne.
Dr. Barg, what are your recommendations for pregnant moms?
So Roseanne asks, is it safe to give it to pregnant moms? Absolutely.
But like what point in their pregnancy?
Pregnancy is a specific risk for having more complicated viral infections. So you want to get it in as soon as you can. And at any point, you know, if they didn't get it earlier, give it later. It's safe all across. There are quite a few studies showing that it's good. And it's certainly much safer than getting COVID when you're pregnant. Okay, let's see. Nobody over here? Okay, go ahead.
With all of the virus circulating in New York, polio virus, sewage, have there been any clinical cases?
Oh, yeah, very much. Definitely. That's what brought it to everybody's attention because somebody had ascending paralysis. Their legs got paralyzed and it went up, and they tested and they had polio. But absolutely. Yeah. Way in the back there.
Okay, so are they recommending wait time between, like, say, your last booster and the new vaccine that's coming out in October?
Yeah, they'd like them. Yeah.
If I just got my fourth booster 2 weeks ago, do I need to wait?
Yeah. So it's a minimum of 4 months. But the strategy at this point is to give you enough time so you get through the winter. So that's why October is a good month. So now it's a good time. Next week it'll be a great time to get either influenza or COVID. So you just want the antibody levels to last through the winter because we're all going to be together more of the winter. So there's more chance to spread. Okay, there was another question. Yeah.
One follow-up on the clinical cases. Have they sorted out if these
these are people that have never been vaccinated or a long time since vaccinated?
Unvaccinated.
Totally unvaccinated.
Unvaccinated, exactly. So, well, I guess that's out of time.
Well, out of time to speak to the. Can you stay for questions? Can you stay here for questions afterwards?
Yeah.
Okay. We kind of come to the end of our meeting time, but Dr. Barg will be here. We'll be up front to answer any questions you want to pose to him. I just want to say thank you, Dr. Barg, for coming in today and educating us on kind of what's going on with the viruses. And and he says there's more to come, so yeah, whoopee. That's a great message, yeah. I do want to say, let you know that what we've been doing this year is, as a speaker gift, we have been making, I guess, a timely donation to the Rotary Polio Plus campaign. And that's been ongoing since about 1988, I believe, and was instrumental in keeping the cases down and eliminating them to 2 locations. But obviously that is changing, and so our donations back into that fund are going to be helpful. So thank you. Next week, on Thursday, not at noon, but at 4 o'clock, we are going to have what I'm calling a Rotary reunion. A different format, different time. We're going to have social hour starting at 4 o'clock, no host bar. We'll have appetizers. And then, hopefully, the fun will begin around 5 o'clock. If you haven't received a call or an email from your class president, hopefully you will in the next few days. Or you might get a call from me. I have challenged myself to call every member in the club sometime during the year. I've started that. I've finished, I'm into the B's, so if you're in the C's and D's and E's, you'll be getting a call fairly soon. So that's to remind you of the Rotary reunion. The more people who come, the more it's a reunion. And we have a lot of members who haven't been here, inviting them back in a different format and hopefully have some fun. So that's the idea there. The week after, we have successful coaching. How does it happen? And we have 3 successful coaches who will hopefully give some ideas. Phil English, Eli Juarez, Katie Hinckley will be the speakers in a moderated format with Bob Romero. U.S. District Court Judge David Estudillo, National Hispanic Heritage Month speaker. That's going to be at the YVC Conference Center. So make sure you have those on your calendar. Committee meetings today. Membership development, David Covey and Brad Hansen. I see Brad and they're both here raising their hands. And if you got a message from the social committee to meet, that has been postponed. So Yakima Rotary, we are a service club. We have a service project, and we hope that we have 100% participation in some way. It's coming up fast. I have to say, I saw Carolyn's office yesterday. I don't want to call her a bag lady, but oh my golly, the bags were everywhere. So she told me she was cleaning it up. But anyway, the bags are getting ready. We're stapling tonight at the education meeting or committee, and hope that if we need more stapled, contact the office. And we need more people to take them to the neighborhoods so they get filled up so that whoever's picking up can pick up a full bag. All right. Thanks a lot for attending. Have a great week.